Okay. Well, welcome to day 3, this breakout panel as part of PeaceCon. The theme of our session is Health, Conflict, Trust, and Context, Local Leadership in a Triple Nexus Moment. I think we all are definitely feeling how complex this moment is, and hopefully have had a number of really rich discussions so far in PeaceCon. My name is Ruth Allen, and I'm very pleased to be here with colleagues from IRC, Mercy Corps, and Local Capacities for Peace International. I'll introduce the rest of the panel in a few minutes, but first wanted to frame the session for us just a bit, noting that we have a 90-minute session, so hoping to make it quite participatory, and hoping we have a small enough group that is really possible. So we are going to be, the way that we've structured the time is that we'll have a few introductory remarks by our panelists in order to talk about the work that they're doing in various contexts around the world. And then we'll move into some breakout time where we can have a really rich discussion about the themes of the session, and come back from that time in order to pull together some of the more actionable observations or critical questions that we can carry forward as a peace-building field into the next steps in this pandemic and post-pandemic moments. So that's the overall session plan, and we'll see where we land at the end. So good. Can move to the next slide. I can actually do that. Very good. So it's interesting to me that this session is coming at the very end of the PeaceCon conference, and yet the opening session had so many of the same themes around trust, around context, around local leadership. And it was really interesting to me to hear responses to Joe Hewitt from USIP, his question at the opening to the panel about, what should we be most concerned about related to the effects of COVID-19 and the pandemic on global fragility and conflict. And from Paige Alexander, reversing hard-won gains, Ambassador Mark Green, now at the McCain Institute, formerly head of USAID, very concerned about authoritarian power grabs. Jada McKenna at Mercy Corps, accelerating instability, and David Beasley, who went first in the session, actually said everything, speaking from the perspective of the current Nobel Prize organization, World Food Program. So, just thinking about the scope of the issues that we're discussing in this session, and the real systems level challenges that they present, that they presented in the first session, were very much aligned with how we organized this particular session. So hopefully we can get quite practical and understanding some of the things related to all of the systems dynamics that are at play in this moment. And that's the subject of some recent work that my organization, Collaborative for Development Action, just did recently. So our role is to be the listening partner, the learning partner for across the Triple Nexus. So thinking about work within the peace-building, humanitarian, and development sectors, but also listening to the issues that overlap those sectors, and how critical questions can be tackled in ways that unlock positive social change. So what we were hearing again and again from peace-building practitioners, from public health colleagues, was just how complex the issues of the pandemic are, because they exacerbate underlying structural violence issues, they exacerbate issues related to all of the public health inequities that are there. So we decided to do some mapping and to see where that might go as far as the guidance that we could provide in conflict sensitivity for this public health emergency moment. and just would draw people's attention to, in this systems map, draw people's, excuse me, to the reinforcing loop that's in the right-hand side of your screen, where issues of distrust of public institutions, issues of governance and failure and crisis, certainly distrust of aid agencies, fear, rumors, all of the issues of underlying public health challenges and inequity issues, that there's a real reinforcing loop there related to trust and the critical role of local leadership. So, with this systems dynamic, we wanted to bring to PeaceCon a conversation, particularly among peace builders, but also hearing from people in other sectors that are relevant to all of these interconnected dynamics, understanding from you all what some of the programmatic responses have been, what we can learn from that, and how we can advise ourselves and our wider fields going forward. So just as a poll of who is in the room, want to ask all of you, and Seth and Xander will invite you to launch our poll there, just inviting people to say, what is your main area of work? Are you primarily a peace builder? Do you work in public health or in another sector? Waiting for the poll to come up. Very good. So go ahead and choose one of those and we'll just see who's in the room. Give people a couple of seconds to do that, including our speakers. Definitely welcome you to take the poll. Give it another 12 seconds and then hopefully people have had a chance to do that. All right, go ahead. Show us some of the results. All right, so not surprisingly, we have a lot of peace builders, but it's exciting to hear that other people also represent the humanitarian response or public health perspectives. For those of you who mentioned other development sectors, please let us know who you are in the chat so that we can be able to pull some of that thinking into our discussions. Very good. All right. So want to introduce our speakers for today before we get into their remarks, and have given them about 7 or 8 minutes to share what they've brought to this group. But then we'll have a lot of time in the conversations, the breakout conversations, in order to ask more questions of them, for them to share more about their experience and their work. So first of all, we have Lillian Kiapi. She's a Ugandan trained medical doctor who found herself joining the humanitarian space when she responded to a note that was mistakenly put under her door during her residency year. I love this story. The note from the country director for an international NGO was asking her to consider joining a refugee health program as a medical doctor. This case of mistaken identity has seen her contribute to the health service delivery in Uganda, Somalia, Northeast Nigeria, Rwanda, Ethiopia, and Kenya. She currently lives in London, and she's traveled under armed escort, experienced health facilities looted by rebels, had to sign proof of life forms, and to be evacuated for security reasons. So Lillian, thanks so much. Her formal bio, along with all the other formal bios, are in your PeaceCon registration information. Very good. After we hear from Lillian, we will move on to Alex Ouma, and who has over 12 years of experience in the nonprofit sector, thematic areas of conflict management and peace building, local governance, protection, and human rights. Before joining Mercy Corps in Nigeria, where he works now as a program manager for the Northeast Conflict Management and Stabilization Program, Alex worked in South Sudan on human rights issues, conflict sensitivity programming, and local governance. Alex also worked in Afghanistan, the Philippines, Uganda, and elsewhere, contributing to creating conflict and early warning systems, strengthening mechanisms for protecting civilians and human rights. He's passionate about public policy and good governance. I share that. And during his free time, Alex listens to music, writes articles, and enjoys watching soccer. So we share a lot, Alex. Finally, Millie Otieno is a Kenyan peacebuilder and conflict sensitivity practitioner, passionately engaging communities, policymakers, media, and humanitarian workers at different levels for people-centered interventions that strengthen nonviolence as a way of life. She's served as a community mediator and conflict transformation trainer in different countries in Africa, the US, Europe, and Asia. And Millie has been someone that has worked with CDA, collaborative learning, for many, many years. So welcome all of you. There are a few other people who are supporting in this session. Ted Holmquist, also from Mercy Corps, will be part of the breakout session with Alex, and Andrew will be part of the session with Lillian. Andrew working as a governance advisor for IRC. Seth Owasu-Monte is with CDA Collaborative, and I think that that's everyone on this large group of people engaging this session. So that's great. Good. So Lillian, I'm going to hand it over to you in order to take us through your presentation, and then we'll make the transition to Alex as soon as you're done. Thanks so much.
Thank you. Will you show the slides? Okay. Hi, everybody. Thank you for joining us today. Next slide. So I'm going to talk about peace and health, and I'll bring in IRC's experience working in these two areas from a health perspective. So the IRC, the slides are not moving. Yeah, thanks. So the IRC works in places where the health needs are greatest. We currently have health programming in 30 countries around the world, working through over 6,300 health workers and over 15,000 community health workers. Next slide, please. So at the IRC, we think about equitable, quality, and responsive health services as being core to achieving better health outcomes for our clients. And these themes are all intimately linked to peace in communities. And so thinking about issues of equity, access, and responsiveness. So whether it's in the DRC or in the United States, where we support health services for resettled refugees, health and peace between groups have always been intertwined. To be effective in health response in conflict-affected contexts, we need to be conflict sensitive. And as a result of this, we focus on looking at health and peace as two things that we should do concurrently. Our COVID-19 response has been built on key lessons learned from Ebola responses in DRC and West Africa. And in the past, in Ethiopia and Uganda, we have included peace building in communities as an integral part of our multi-year health projects in those two countries. At the IRC, we think about equitable, quality, and health services implemented in partnership with local communities as core to achieving better health outcomes for our clients. Next slide, please. So today I want to talk about two case studies about where we implemented health and peace building together. The first is DRC Ebola Response in 2019, which had to integrate a community engagement, feedback and partner adaptation, partnership and adaptation approaches. So as we have seen during the current COVID-19 response in refugee communities in Bangladesh, Kenya, and Uganda, risk communication and community engagement processes have involved conflict mitigation and resolution between refugees and host communities, as well as working with community leaders and other modalities. And we've based these approaches learning from what happened during the DRC Ebola response last year, when communities rose up against health workers, the UN, and NGOs, because the response was very health focused. So at that time, IRC adapted our approach and took a bottom-up way of building trust and ensuring transparency through risk communication and community engagement, which became a deliberate approach we took, as well as providing holistic support to beneficiary communities rather than focusing only on health. As a result, this reduced conflict and misunderstandings, which had led to the violence protests. What we learned was that establishing feedback channels with communities, as well as partnerships with local organizations, the Ministry of Health, enabled the response to be based on feedback that was grounded in real life experiences and perceptions. So the community engagement approaches we used included use of mass media, digital approaches, as well as specific and general outreaches to the population. And we found that providing community-centered and community-driven wraparound interventions to address community needs and priorities helped to improve acceptance of the response in the affected areas. Next slide, please. My next example is from Karamoja in Uganda. In this region, IRC integrated a peace-building component into a 3-year maternal and child health consortium project. At the time, this region was plagued by inter-clan violence and cattle rustling, and the region and communities in that region had pre-existing peace committees set up to support conflict resolution. So women's peace committees evolved from these community peace committees as a structure that we could engage with in terms of determining service locations, as well as creating access. We worked with women's peace committees as a community engagement strategy to ensure that project staff were always aware about what was happening in the community, as well as aware about community perceptions and taking these on board in terms of scheduling services, as well as where to locate services. The pre-existing peace building activity provided a necessary foundation for health outcomes to be achieved, and peace building provided a foundation of trust with a community between groups of conflict, between groups in conflict, and also trust between communities, NGOs, and the government coming to support the area. So by integrating peace building as part of that health project, IRC was not only more effective in achieving health outcomes, but also able to contribute to peace as a secondary outcome. Next slide, please. So in conclusion, I just wanted to say that people do not live their lives in silos. People experience conflict and they experience illness at the same time. Our solutions must have a holistic approach that does not just address immediate needs, but looks to address drivers of needs as well. And we can do this through health services that are equitable, quality, and responsive. We can do this through approaches that engage in conflict settings at a minimum conflict-sensitive health, and ideally actively designed to build peace. And lastly, working in partnership to strengthen local systems and reinforce local capacity rather than substitute for it.
Lillian, thank you so much. That's incredibly helpful to hear from the perspective of IRC and from a medical doctor, understanding the interlinkages here. I love how your slide moved from health outcomes to peace outcomes and health outcomes in parallel, and heard a lot about the peace building as a foundation of trust. We'll explore that theme more in the small groups. So thanks again. We'll shift now from London to Nigeria, where we have Alex from Mercy Corps. Welcome, Alex.
Yes, thank you. Thank you, Alan. Maybe if you could move to my slide. Yeah, thank you. So just to give a little background on the context in Nigeria. So the context in Nigeria is quite complex. So I would like to give a bit of a background to put into context some of the interventions that CARE and so that Mercy Corps and some of our partners are implementing under the Northeast Conflict Management and Stabilization Program. So to put it into context, the uprising in Nigeria started pretty much around. Can you move to the next slide, please? Yes, so the uprising pretty much in Nigeria started around 2009, and then moving around 2011, the government of Nigeria launched a military encounter, an operation really meant to root out all these armed opposition groups. But around 2013, 2014, the conflict didn't really subside. Actually, violence escalated and attacks against civilians escalated. And it's estimated that up to about 20,000 people have been killed in the conflict, and about 1.7 million people displaced, and an estimated 823,000 are cut from humanitarian assistance. So if you look at the map of Borno State, precisely shows this is largely the area that is affected by the ongoing conflict in Nigeria. Can you move to the next slide? So yes, the conflict in Nigeria is already happening against the backdrop of several challenges that exist within this part of the country. Borno State is already among the poorest states in Nigeria, but also the armed opposition groups sort of use these existing challenges to sort of justify some of their actions and try to use that notion to recruit young people or to mobilize communities to support some of their activities. So looking at this kind of context, you see that service provision is very poor. Education system is not as compared to other parts of the country. In terms of the governance infrastructure is a bit weak. And operating in this kind of atmosphere, you find that there's a lot of disinformation, and access to state institutions is quite a challenge. Security forces, whether it's government forces or indeed non-state armed actors, constantly violate human rights. So it's within this kind of context that a lot of other issues are also existing. For example, the lack of social contract, or the breakdown in social contract between the government and the community sort of adds to the already existing challenges that exist in Borno State. Some of the issues, the deep-rooted conflict drivers that exist in Borno State actually predate the ongoing insurgency caused by the armed opposition groups. Outsiders popularly know it as Boko Haram. So if we're looking at issues such as the breakdown in governance, lack of trust between citizens and the government, all create a situation that fuels this sort of drivers and conflict. And already in this kind of environment, there's a divisive system where youth and women especially are not seen as or perceived as people who contribute a lot to the development of the society. So in terms of even their opinions, even participating or taking part in mainstream development, these are things that are still non-existential in this particular part of the country. So looking at all these the deep-rooted causes, but also looking at the ongoing armed opposition group activities in Nigeria. As Masiko, please go to the next slide. As Masiko and its partners, we are implementing a program funded by DFID, which is mainly to promote, resilience and peace building. So in terms of our approach, we are using dialogue as a platform where residents and the government, but also intercommunal issues can be discussed and can be brainstormed before they escalate into high-level violence or bigger conflicts. We're also looking at joint actions. These are quick interventions that residents can come together to implement as peace, as more or less peace dividends, really, to incentivize peace in the communities. And trauma healing. Trauma healing is one of our strategies that we use as a pathway to facilitate or to mitigate hindrances to community reconciliation and peace. And then citizen-centered advocacy. Masiko and partners, we have created a number of community structures that we have empowered them with advocacy skills so that they can lobby on behalf of their communities for different things, namely service provision or even peaceful resolution of conflicts. And then Masiko and partners also have created youth and women platforms that provide a safe space where they can engage, interact, develop confidence, but most importantly, also use these platforms to demonstrate that the youth and women also have a central role to play in the mainstream development process. And of course, radio plays a part in helping us to amplify our works and strategic influence using our partners, our networks. We leverage on some of these existing partnerships to sort of create more strategic impact of our programming. Move to the next slide, please. Yes, so just in synopsis, I wanted to summarize how, in terms of the Northeast conflict management and stabilization program, in terms of how the Nexus approach fits into the kind of work we are doing. So we are looking at community engagement and governance in decision making as contributing to more dialogue of residents, marginalized groups being able to meaningfully participate in some of these processes, which again I mentioned earlier, such as women and youth. But also we are looking at trust building between citizens and state to deliver peace and development. One of the issues that exist among residents and citizens is that, for example, youth are perceived not to be contributing anything to the development process, but also communities look at government as they're just eating the money. They're not delivering services. So a lot of these trust issues, this is where we look at all this where it fits. That trust, is built between citizens and state to deliver peace and development, and then strengthen capacity of governance structures. Through the different programming that we have in Masiko, we build the capacity of government counterparts to be able to not only protect civilians, but also to be able to deliver the services. But we also empower the local community and traditional leaders to be able to, demand and advocate for better service delivery in the communities. And so looking also summarily at conflict and COVID. Of course, COVID had a substantial impact in this particular environment. For example, the state society relations in terms of even the way government created some of these restrictions Sorry. Yes, so even in the way government created some of these restrictions sort of caused a lot of tension between residents and the government. And of course, the armed actors, for example, used even some of these narratives to sort of lure young people and youth, especially to join some of their movements. So our response as Masiko has been mainly to create more awareness, to facilitate dialogue sessions, but to also help build the capacity of government structures. We help the government to revise, for example, its COVID-19 preparedness and response plan by bringing on board residents from different parts of the community to understand the plan, to interact with the plan, and to also give their input and to begin to create more trust so that the community understands why government is doing some of these things and the messaging that goes with it, and to be able to take part in some of these initiatives. So some of the key lessons that we've learned in the process, we have learned the significance of the significance of bringing government together with residents, that constant communication, that dialogue to help to address conflicts before they spiral out of control is one element that brings trust. We have also seen that participation of community leaders in a lot of these platforms helps to strengthen compliance with guidelines and combat rumors associated with COVID and also associated with conflict. And we have also seen that the community structures that Masiko and partners help to create have helped to strengthen communication between the government and the locals in terms of how the issues from the grassroots are able to be escalated to the high up level to facilitate delivery of services. And maybe finally, we're looking at advocacy as an empowerment tool that some of our community groups and structures that we've created over the years are using to sort of enable government understand the service gaps a bit better in the community and tailor development related interventions to address some of these needs. Of course, there without gaps, there are several gaps that exist, but some of these structures that we have helped to create are already beginning to reap fruits of the works that we aim to achieve.
Alex, thank you so much for taking us through this. We understand that you've had a pretty intimate experience with COVID, and very sorry for that. Glad you are feeling well, and know that all of this is very personal for you, even if you were not in that situation. Hearing how Mercy Corps is dealing with the fraying social cohesion and all the challenges of governance. Really interesting to understand the going back to community leaders and some of the roles there related to combating rumor. So we'll hear a little bit more about some of those issues from Millie. So from Nigeria to Kenya, Millie, we'll hand the mic to you.
Thank you very much. Actually, to Kenya and the East African region, because we have come to realize that our issues in the region, actually in the greater Horn of Africa, are very much intertwined, just like issues in the other parts of the world. And so just to echo what my colleagues have said, the pandemic has actually exposed the underbelly of some of the weaknesses within the institutions of governance, and therefore, in some cases, exacerbated some of the conflicts that have been in our areas, in the region, in the East African region, and specifically in the Kenyan context. And so, Ruth, if we may go to the first slide. I think it is not news, and my sister Lillian will resonate with the picture about, on the pastoralists and the kind of lifestyle. And most of the conflict around our region has been to do with resources. Communities wanting to get access to resources or control of resources. And so when the pandemic happened, in the case of Kenya, we were not just going through COVID-19, but we were facing real big challenges that had to do with flooding. So natural disaster worsened, so people had to be confined in spaces where they had to be safe because of the floods. And yet we also had to ensure that the health protocols within the, that ensure that the COVID does not spread within those situations were also adhered to, and that posed a real big challenge. And so the issues of resource-based conflicts also just got worse. But as you all know, also in the region, we are facing a lot of political violence and crisis of governance. And my colleague from Bangladesh has alluded in the chat that they are facing mass corruption cases in Bangladesh. And I think that is something that we are all struggling with. And we know that where there's corruption, health services go down, education is mismanaged, and therefore it just makes the community more desperate, and sometimes it can lead to violent conflicts. And again, one thing in our region, in the Horn of Africa, the issues of radicalization and violent extremism cannot be understated. There's been efforts towards that, but we have to acknowledge that this really pose great challenges. So already the international efforts to come in and support dealing with some of these sticky, wicked issues, the problems that plague our region, and specifically our country, Kenya, has only provided short-term stability. And we have seen cases where the local structures, peace committees, community policing committees, in some cases we call them nyumba kumis, have been very active and very strong in ensuring that sustainable peace processes are carried forward and actually led by the communities. And this is something that we wanted to posit, that yes, these structures are there, but they still a trust deficit. Let's go to the next one. As local capacities for peace, we have been engaged, working with the community structures, as we have said. We realized as interveners that really having local communities to take charge of some of the responses was very key. I say this because when the health protocols were given by the government of Kenya, Ministry of Health, and the communities did not understand why their lifestyle had to radically change, why there were curfews, why there were shutdowns, why they could not move from one place to another. And then the government invoked the power of the forces, and the police were very brutally implementing these protocols. And this caused a lot of harm. And so we had to come in and say, what is the best way? What are the conflict sensitive approaches that the police could use? And that's where our community policing teams came in. So using conflict sensitive development and media approaches, we were able to go out and sensitize people through the media platform, social media and mainstream media, and also reaching out to the police, talking about community cohesion and helping communities to find meaningful ways of engaging even with the difficulties, telling them that your safety is important and it is not up to the government to enforce the safety for you, but they provide the policy environment for that to happen. And so we have seen that the more uptake of use of internet and social media was helpful in some ways to enlighten the communities of the dangers. But on the other hand, we saw a lot of disinformation and conflicts coming up because of the misuse of the internet and cyberbullying. And COVID-19, really the stigmatization of the people who were affected got worse because they were being trolled on social media platform. And so this was used, the platform was now not being very helpful as much as it was one of the things that we have used to respond. We also highlighted the challenges that comes with that. Overall, we have realized that our interventions were more effective when we worked across levels. We have been engaging with the national government, where we had to go and sit in the gender technical working groups, so that when these health protocols are being issued, they are issued in a manner that is also understandable to the local people. And that made us even translate, I will talk about it later on, translate some of the material into local languages and help people to understand. But this enhanced collaboration and multi-agency approach really worked for us, because then the security teams were able to listen to civil society organizations, and the communities were also able to find spaces to have conversations with the security teams. And this, in the long run, improved the community policing and helped us to look at issues of accountability, telling the police that they are part of the community. And so whatever they are doing, the securitization and militarization needs to go down, and more of dialogue and conversations should actually take precedence. Let's look at what happened after these responses. Our results, Ruth. Some of the things that were really key, I've spoken about this COVID-19 response and the radio programs that we did with the communities, and also the work that we did to engage the police, and just having some social contracts, but even in some cases, some written contracts, and also going through some of the protocols. The one thing that we noticed as we were reaching out to the police, we realized that some of this exacerbation of the conflicts and tensions between the security teams and the community was because of their working environment. The police were expected to enforce these health protocols, but they didn't even have masks, they didn't have PPE materials, they didn't have even hand wash stations. So some of the things we did were to offer some hand wash stations, and also to ease in some of their tensions, because their stress levels were very high, and engaging them helped them. We helped to rehumanize them and made them, become part and parcel of this. And so I just wanted to go to the results. If you may move to the next slide, Ruth. Some of the things that then happened is that, first and foremost, we got more acceptability, and even the trust deficit was bridged between the community policing committees and the security teams, and also the public at large. When the public got to understand that the police were just doing their job to enforce some of the protocols for their own safety, they were able now to also negotiate. Because sometimes if it's curfew time and you're still out, you can still argue your case, or at least be able to talk to the police. And because the police also knew that there was people watching, issues of accountability and respect of human rights were now more enhanced. There was also community outreach forums where the awareness was being created. It's still going on. One thing I want to mention is that these are not one-off things. This is work that we have been investing in. And that's why when we talk about systems thinking, you know that when you break one way of life or culture, how people behave, then you know that sometimes there will be a fight back. So when we were trying to enhance accountability, there were issues of how about responsibility? Because you want to hold me accountable, how about you performing your responsibility? So it's a two-way thing. And these forums really helped people to talk about accountability, responsibility, and common ground, how we can move together, and therefore strengthening the ties between the law enforcement, the health workers, and the community at large. And this, I want to give an example of one part of the country where we are mainly working in the Kisumu County. It enabled us also to engage with the county government. In Kenya, we have a devolved system. We have the national government, but we also have the devolved government, which is the county government, working at both the national government and the county government, and also with the regional blocks, helped us to try to see how these good practices can be modeled in the neighboring counties. And that was really helpful. And this is one thing that we are still struggling with. As we go through the pandemic, we still have people who have been displaced by floods in the Kisumu County, and we are still trying to find how to keep them safe and how to help with the early warning. You are right, just move on to the next one, because the next one is very important. The reason why the next one is important is the role of technology. I've alluded to it. But in this particular case, for those of us who are involved in peace building, we know that conflict early warning and real-time response is very key. And in this time of pandemic, we were using the, contact tracing as a way of saying, how can we then borrow what we are using in contact tracing for the conflict early warning, so that we can also be able to deal with countering extremism and using those more, if we were able to trace people really and track them, how can that apply? And in our country, we have the Uyano Platform for Peace, which is a multi-stakeholders platform that has been very instrumental. And the Mulika platform is one of those platforms that has been helpful for the conflict early warning, which is also embedded somehow in the Uyano Platform for Peace. How this Mulika platform works, it is a short messaging text line. You know, it's an SMS. So if you see somebody breaking COVID protocols in your area, you can send a text message. If you see somebody breaking into a house, you can send a text message. If you hear that people are planning to go and attack, or there's some acts of violence that are being planned to be committed, you can send a text message. The beautiful thing about this platform, and I speak about this because of the power of the technology, is that this message goes to the top most level officers in the security system. So the minister in charge of interior will get it, the police inspector general will get the message, the county commissioner in your specific area will get the message. All of them get the message at once, and therefore activating response. We say this because early warning has been not very active in peace building because the responses. This has helped us in the case of managing COVID issues, because when people have been sending these messages, then those who are suspected to be coming from areas that were COVID prone were able to be, tracked, and then the issues were nipped in the bud. So I just wanted to say that has been a good thing in the use of technology, and more civic education in engaging people, to talk about pandemic, how it disproportionately affects women, how it also affects our peace building work, because as Lillian said, it's not just about health. This issue is about all of us. So moving forward, we have also seen that not only using the digital system, but also tapping into the traditional mechanisms that have always been there. We've been able to reach out to so many other people. Ultimately, what we are saying as peace builders, dialogue is very important. Analyzing the situation is key. Understanding that, data is useful for our work, and this new media, divergent voices, and all of these issues actually affect our work. But if we go into intervening without taking into account the conflict sensitivity, the gender sensitivity issue, and the trauma informedness in our interventions, then we may miss it. In our case, we have just tried to model how conflict sensitivity can be used in addressing, responses through security teams, and at the same time engaging the communities in a trauma-informed way, so that they can also appreciate that whatever we are doing is for their common good. So this is just the presentation we wanted to share with you, that when the communities are in charge of their solutions, then indeed you will see a difference. One question that we had, which I thought we could just brainstorm about, is the issues of conflict analysis and monitoring, strategic communication and dialogue and networking. These are some of the questions that we were posing, because we said our work was only effective because, number one, we understood the context, and we continue to try to do analysis. And in our analysis, we don't just do analysis for the sake of it, but we use the findings from the analysis to inform, be it health intervention, be it education, be it peace building. It is important. And for you, do you find this useful? How about strategic communication? How do you create linkages? How do you ensure that this information is dealt with promptly? Is this something that you may want to engage in? And lastly, dialogue and networking. Do you find this one of the important things in your work, in your different areas, as you deal with different issues? I just want to end there because I'm being sensitive to the time. And I know that we are going to go into the groups. Working with different government levels has been our strength. Working with different communities, groups has been also an added advantage, and understanding being there has been very useful. This is what made Kisumu County identify Local Capacities for Peace International as one of their partners to help in translating the COVID World Health Organization protocols into the local language and helping to disseminate through the radio programs that we did. So I think the last slide, Ruth, is just one of the things that you may want to have a look at. But before I conclude, I wanted to just say that despite the fact that women and men are disproportionately affected, I think our efforts should focus on women. In our case with the COVID response, we ensured that we worked with the security to explain to them that expectant women could be allowed, and we got special passes so that we set up a platform where if you were expectant and you needed a quick response to go to the hospital during the curfew period, we were able to provide safe passage so that they could not be brutalized, so that they could not be raped, so that nothing could happen to them. So our responses should also take into account the gender-specific needs of women, girls, and boys. Thank you very much. Back to you, Ruth. Lovely, lovely being here.
Thanks so much, Millie. There's a lot of food for thought there, and appreciate hearing the experiences of Local Capacities for Peace International, particularly on the bridging the trust deficit and some of the practical examples at different levels. You know, I'm hearing a number of themes between the three presentations, particularly related to the role of government and the role between the security forces, the media, especially women and youth groups and different segments of the population having different relationships at different levels with security forces, with the public health system, and with government authorities that are responsible for all of those things. So it's really a very complex web, as much as the web that we showed at the beginning is a complex web of issues. I think the web of trust relationships, and we're hearing a lot from each of you about the interrelationship of the different types of actors coordinating together in the space to address some of the trust challenges. So we're going to be moving next into some small groups. So it's a bit random, but you'll be placed in a group either, here, I'm going to advance the slide, either with Millie and myself, with Lillian and her colleague Andrew, or with Alex and his colleague Ted, in order to just have a discussion on all of the different things that we've been presented with, sharing your own experiences. I know we have, from the chat, we have people participating from Wales in Europe to Myanmar, people who are participating across the US. So really appreciate how many of you are up quite late at night to be part of this live session, and hopefully we'll have some interactive time now. We're going to be moving into the breakout groups, and we'll have about 20 minutes in the breakout groups to really tackle this first question primarily. You know, what are the lessons about trust that we can take from working across the Triple Nexus, understanding aspects across the Triple Nexus that we can really apply to joint peace building and health initiatives. I appreciated Lillian's graphic with health outcomes and peace building outcomes there together. Things that we can be thinking about right now during the pandemic, but also in a post-pandemic reality that we'll all be facing very soon. So, and as you have time, some of the other prompting questions that we put in the framing of this session focused on, you know, what localized efforts must take the lead. You know, how can international organizations be in solidarity with those efforts? In what situations do international organizations or institutions need to lead? And what are some of the key guiding principles and models that we can take away to our programs? That's what we'll come back to the session to discuss at the very end. So pulling some of the themes from your discussion into a bit of a next steps and what it all means for additional research or programming or policy advocacy. So Seth, I'm going to invite you to go ahead and send us off into the break. Welcoming everyone back to the main session. Hope that there were some fruitful conversations. We invited you all to tackle this initial question about lessons about trust that we can take from working across the Triple Nexus into this pandemic moment, specifically for the peace-building field, and also giving ourselves advice for the future. And hearing about localized efforts as well as guiding principles for cross-sector collaboration. So welcome each of the small groups to share a little bit about what you were hearing. I don't know if that's Ted and Andrew, or whether you have designates in your group to share the highlights of your conversation.
Thanks, Ruth. I'm happy to jump in and kick us off. So we had a really interesting discussion, I think, diving into this issue of trust and talking about trust from, I think, a number of angles, from the way the pandemic may have exposed a lack of social connections, especially we were talking about the US and UK context in terms of relationships between neighbors or relationships between communities, and how those relationships are not strong. Also just difficult to then get across those messages of accountability to your neighbor, accountability to your community, in terms of being responsible for taking appropriate actions. And then also bringing in some other contexts, Ethiopia, about trust in government or trust in service providers. Lillian spoke a bit about the experience of IRC's health programs, really learning that lesson that community engagement and community trust as an essential element to health service provision, and getting people to trust the messages that were coming out, kind of lessons learned from Ebola, taken to the COVID-19 response. So I would say, yeah, just kind of to summarize, I think our group discussion was quite interesting as it covered a range of context and shared both kind of people's personal experiences of COVID-19, along with the work that they've done in other countries. And I think COVID-19 has allowed a kind of helpful dialogue about how every context is unique and has a set of different trust dynamics that are important to understanding, whether it's about trust in your neighbors, trust in the local health providers, trust in your, national messages that are being received, and how that translates to fighting the pandemic.
Very good. And you mentioned Ethiopia specifically. Were there other contexts that were referenced in your discussion?
So I think those are Ethiopia, Wales, and the US experience from a number of different states.
Great. Thanks so much. Very good. So Ted, I'll hand it over to you unless there's someone else from your small group that wants to share.
Yeah, I'm happy to kick off some of the reflections from our group, and of course, any of my colleagues from that group, please feel free to jump in after. I'll just pick up maybe a couple of things that were mentioned that we went over, and one was about how trust really takes time. And we heard about an example from the Philippines where one of our colleagues was working on a program with the community to sort of identify some of their needs around education programming and how that related to peace building as well. And that initial period took a year, and it was because of the trust building portion. And there was some pressure even from a donor saying, well, it's a year, when are we going to see the results? But actually, that was the crucial part, building that relationship, building that trust. And then so much more was able to be done afterwards on that foundation, but it takes a long time. So that's kind of what's required, but also one of the challenges we face. And another important point that was mentioned was the fear of failure that we sometimes have. And this was related to the time it takes to build trust, but also the questions around localization as well, where it was said that so often we want to present everything that it's all going very well, we're achieving everything we expect all the time, and everything's always on track. And we know that it's a lot more complicated than that, and that we're naturally going to face a lot of setbacks. And so we need to be able to be a little bit more comfortable with failure, with the challenges, with the setbacks, so that we can actually be honest about what we're achieving and achieve more by having a better awareness of that. So those are some of the points to come out of our conversation.
Really interesting. I think that I hear some common themes going through. Beyond the Philippines, were there other contexts that were referenced in your group?
Primarily Nigeria as well. We went back to some of the examples we had there in Alex's presentation.
Yeah, very good. Okay. Well, I'm happy to summarize a couple of the points that came up in our session, and then Millie, definitely welcome you too as well. As far as the additional points, just trying to make sure that the role of misinformation being very localized. Millie gave an example of in Kenya, specifically people talking about COVID, you not being able to get COVID, or it won't be able to survive because of the heat. I've actually heard the opposite of that in some contexts where people say, oh, it's the winter, it won't possibly survive. And so just the local misinformation and the specific knowledge that's needed in order to address that. And on the flip side of that, the indigenous knowledge that is from the local environment, and bringing both of those realities into dialogue and the opportunity to find what is most essential in the specific context in order to work with the appropriate health practitioners, the appropriate government, security forces, all the different community groups. So we talked a lot about that systems perspective as well. We heard from our colleague in Myanmar. We also heard from colleagues in the US state of Georgia, which is at a political epicenter right now, and people that have experience working in the Middle East as well. So thinking about the economic realities of people in addition, as an additional burden to the health situation and to the peace and conflict situation was something else that came up, and also interest in doing research related to funding flows in the peace building field in order to address these systemic issues like health inequities. So I think that Millie or others from our group, anything that I missed that it's a different highlight from the other points raised by Alex and Andrew? Millie, you're muted if you're speaking.
Yeah, no, thank you very much. I think you've summarized it. For me, just understanding that the things are so complex, you know. Hearing what is happening in Georgia, there's that political element, the climate change issues, as I mentioned, sometimes, you know, flooding and all this. And so focusing on one thing over the other is a big risk, and risks eroding some of the good work that we have done. Again, ultimately, you know, we need to ask ourselves whether our practices are sticking, you know. If we have been promoting peace building, nonviolent conflict resolution mechanisms, dialogue as a way of life, facilitating community processes, are the people at the center of it all. And this, I think, when Catherine asked in our group, you know, are we being listened to? Are we listening to each other, or are we talking to the wall? These are kind of things that always keep coming into my mind as we talk about challenges in terms of pandemics and conflict and violence and instability or stability in our areas of work as well as our areas of residence. But of course, the conversation goes on, and I believe what we have had running across is that information is power, and disinformation can basically erode everything. And so we must really check, how do we package what we present, and how do we then help people to understand what really the reality is from the other disinformation that is all around us that may erode our peace work.
Well, Millie has clearly given her opinion about the poll that's coming up as our last point here to wrap us up. But Seth invites you to launch the poll. We're looking at the question of, over the coming 1 year is going to be in a very intense time in human history as we try and do something that's so global and yet so local at the same time. And so, as the COVID-19 vaccines become available, we're hearing reports from Oxfam today that there's risk of 9 out of 10 people that live in contexts of conflict maybe not be able to have access. Just a tremendous number of challenges. What is the most important role of the peacebuilding community? Invite everybody to vote at this point. Just putting a real, very specific point to what we need to be doing over the coming year. Should we be leading context-specific conflict analysis and informing public health activities? Should we be playing a very direct role in coordination with public health actors, leading activities to mitigate misinformation, disinformation, leading advocacy for equitable vaccine access? Focusing on addressing rising instability or researching the policy advocacy about mid and long term. Certainly there are a number of different options, or welcome you to add them to the chat. We'll be recording that as well. So we're forcing you to choose one, and we'll give everyone about another 5 seconds to do that. Please choose wisely, and then we'll see the results. All right, go ahead and share those with us, Seth, if you would. Interesting. So across the board, there are roles that the peacebuilding community should be playing. Very interested that this issue of misinformation and disinformation and building public trust is coming up so strongly. I think that that's a role that we as a peacebuilding field are prepared to play, and certainly feel like we're calling ourselves to do so. So I'll conclude the session there and very much appreciate everyone's engagement. Put up the last slide here that gives you our information, at least on Twitter, and you can find us easily in other social media channels. Thank you everyone for participating and for your great ideas. We will be following up with the Alliance for Peacebuilding about how we can capture some of the good suggestions from this conversation in future meetings, including of the locally led peacebuilding working group that the Alliance for Peacebuilding, CDA, and Peace Direct co-chair. And so that's a forum for you to engage with if you are not already working with us in that space. Thank you again.